Imagine your doctor sees something concerning on an imaging test, like an ultrasound or a CT scan, and wants to understand it better. This isn't necessarily a cause for alarm, but it means they need a clearer picture. What is the next step to truly know what is going on? A biopsy test is precisely that next step. In simple terms, it is a medical procedure where a small sample of tissue or cells is removed from your body. This sample is then sent to a laboratory for careful examination under a microscope, helping doctors to accurately diagnose various conditions, especially when they need to determine if an abnormal growth is benign or malignant. The core reason biopsies are so crucial is that imaging tests, while incredibly helpful, can only show structural changes or suspicious areas. They cannot tell us what the cells themselves are doing. Only by looking at the actual cells can pathologists, who are doctors specializing in disease diagnosis, determine the exact nature of the problem, whether it is an infection, inflammation, or something more serious like cancer. This cellular-level analysis provides the definitive answer needed for diagnosis. During a biopsy, the procedure itself can vary greatly depending on where the tissue sample needs to be taken from. For instance, a fine needle aspiration uses a very thin needle to draw out cells, often guided by imaging. An endoscopic biopsy involves inserting a thin, flexible tube with a camera and tools to collect samples from internal organs like the pancreas. Sometimes, a surgical biopsy might be necessary to remove a larger piece of tissue. In most cases, these procedures are performed with local anesthesia to ensure your comfort, and you will receive clear instructions on how to prepare and what to expect afterwards. One fascinating aspect of biopsies is the role of the pathologist. These medical detectives are expertly trained to identify subtle changes in cells that indicate disease. They are not just looking for the presence of abnormal cells but also their type, grade, and how they are arranged. This detailed microscopic evaluation, sometimes including special stains or genetic tests on the sample, offers a comprehensive profile of the condition, guiding the most effective treatment plan. Sometimes, a rapid assessment called a frozen section can even be performed during surgery to get immediate preliminary results. Ultimately, a biopsy provides invaluable clarity. It transforms a question mark into a definite answer, giving you and your healthcare team the precise information needed to understand your health condition. This diagnostic certainty is empowering, allowing for informed decisions, appropriate treatment selection, and ultimately, a more targeted and effective path forward for your health and well-being.